In July 2011, South Sudan was already faced with a difficult situation, with food insecurity, limited access to healthcare, and population displacements caused by interethnic violence. And now there's another emergency: the arrival of over 200,000 refugees fleeing the war-torn regions of Sudan. These refugees, who are particularly vulnerable, arrive at already overcrowded camps, having had to leave behind them those who were unable to travel. Many of them are in Yida refugee camp.
We're providing care to the sickest patients, for both pediatric and adult patients, as well as patients suffering from complications of malnutrition. The cases that we're seeing today are significantly more severe than the cases we'd seen prior, with an increase in mortality, and it's really putting a challenge, and the team is really challenged to respond. So we're increasing resources, both human resources and medical resources, to be able to take care of the patients.
Every day sees the arrival of hundreds of new refugees in the camps in Maban County. MSF is preparing to open a third field hospital in one of the camps in the area to provide treatment to the many refugees suffering from diarrhea, infections and malnutrition. But the main challenge remains in the ability to supply sufficient quantities of clean water to the ever-increasing number of refugees. Although there is a functioning healthcare system in the Palestinian territories, access to specialized care is still very difficult. People suffering from severe burns and burn-related deformities need reconstructive surgery. Youssef here was burned in a fire caused by a candle when he was a month old, which left him severely handicapped. But Youssef has been admitted to the MSF Reconstructive Surgery project, which was set up in collaboration with Nasser Hospital in 2010.
At first, he couldn't open his mouth. I had to help him get a bit of food inside him. MSF operated on him, and now he can feed himself. They've also operated on his nose so he can breathe better. And his fingers used to be all stiff. He couldn't pick anything up with his hands. They've really done a lot for him.
The project gives patients who are unable to leave the Gaza Strip access to appropriate care. It also enables expatriate doctors to transfer specialized skills to their Palestinian peers, as they too are penalized by the embargo. A little boy suffering from malnutrition in Chad has been given a dose of ready-to-use therapeutic food. An MSF team has given his mother what she needs to continue his treatment for several weeks at home. This distribution is part of a large-scale operation to treat the recurring issue of malnutrition in the Sahel.
This year, for the first time, the humanitarian system is setting a really ambitious objective to treat 1 million children for severe acute malnutrition. It'll be difficult, but it's certainly possible. Of course, we have the usual constraints of poor road access and flooding, and weak health systems are ever present. And on top of that, this year we have the security problems in Mali and the neighboring countries. But we're used to working with these kinds of conditions, and it's definitely a realistic objective.
This objective is a step in the right direction. But to improve treatment for children, there needs to be a radical change in our approach. In the face of repeated emergencies, MSF recommends breaking out of the emergency response model. Effective solutions such as prevention and early treatment of malnutrition must be seen as part of the package of basic health services, just like vaccination. This woman and her 2-year-old boy live together in a small room. HIV positive and co-infected with multi-drug resistant tuberculosis, she has transmitted both diseases to her son. The heavy treatment required is difficult to tolerate, particularly for a child.
The pediatric cases is a big concern. We are getting more cases, and unfortunately here there are not pediatric doses to the patients. So it's not accurate, and the patient could be overdosed or underdosed, so it's a very bad situation. We will wish that there is more research or more investment of this kind of drugs, so we could give a better treatment to the children.
The MSF clinic in Matsafa is treating 26 children co-infected with HIV and tuberculosis. Every day they're confronted with the lack of new diagnostic and therapeutic tools for pediatric cases. Without research that takes into account their specific needs, children simply will not be offered anything other than inappropriate treatment. The triatome insect, the tsetse fly and the phlebotomb sandfly, 3 deadly killers responsible for Chagas disease, sleeping sickness and Kala-Azar respectively. These 3 parasitic diseases, that are also neglected tropical diseases, kill tens of thousands of people every year. But available diagnostic and therapeutic tools are too outdated and too complicated to use. An MSF report clearly shows that action must be taken now if the World Health Organization's objective of eradicating some of these diseases by 2020 is to be reached.
In order to achieve progress towards controlling these diseases, strong political will is needed. Endemic countries need to take leadership in setting priorities for research and development, for development of new tools and for new drugs, to allocate more funding for treatment and control programs, and to spur innovation.
Screening and treatment of Chagas disease in Paraguay, Kala-Azar in India and South Sudan, and sleeping sickness in the Central African Republic. Despite the lack of tools, MSF has deployed innovative strategies adapted to conditions in the field, and proves that patients can be treated wherever they are.